So today I'm going to be talking about care of the newborn. We have discussed the events at the time of delivery and what happens in the hospital. Now in the hospital they will have checked his measurements, will provide you with the weight, the length and the head circumference. They will also have checked, like I mentioned, his breathing, his heart rate, his color and his activity, and will of course assure you that it is a healthy baby. Now this is a very special occasion, and most parents are delighted to have a healthy baby, whether it's a boy or a girl. In the hospital, of course, there will be other things that will be done. One is the first set of immunizations, and you should get it done in the hospital. That is the BCG shot, which is given here in the arm, and polio drops, which are given by mouth, and in most places the first shot of hepatitis B is also administered, and you should remind them. There are some screening tests that are advised. One is for thyroid screening, and of course the hearing and the vision is also checked in the hospital. Now, when you take the baby home, you will see that this is a very active, dynamic, alert baby, and has a personality of its own right from the beginning. And you'll have to sort of understand that personality. The baby can see, the baby can hear, the baby can smell, and of course the baby can communicate. Now, communicate means he or she is not going to talk to you, obviously, but that is crying, and you will soon find out why is it that the baby is crying. Is it because the baby is hungry? Is it because the baby is overcovered? Is it because the baby is wet? Is it because the baby is in some discomfort, has gas, for example, or needs to be changed, or that perhaps he's been overfed, as some others would do. Now, a number of things that these babies do that sort of is different compared to later life. They will often yawn, they will sneeze, they will cough, they will spit up, they will occasionally squint their eyes, which is surprising to most mothers, and sometimes their breathing will become erratic. It may become very rapid at times, and it may slow down. These are all actually normal. So one of the first things that you have to do is to understand that this is going to happen. Babies also sleep a lot, and some babies will sleep as much as perhaps 20 hours out of 24 hours, and that's all right as long as the baby is being fed and is active otherwise. Now, feeding, of course, is very important, and we want you to be giving serious consideration to breastfeeding, which is the best form of nutrition, and it should be done on demand, but we feel that approximately 2 to 3 hours apart is what is recommended. You have to take proper precautions. The mother can eat and drink whatever she's taking normally. She doesn't have to drink extra milk to produce milk, but she should be well hydrated, drinking a lot of liquids and resting a lot. Now, at home, what you also have to do is make sure you keep the baby separate from other people, and so this is not the time for kissing and hugging and putting fingers in the mouth of a baby or crowding. You'll also have to make sure that the temperature around the baby is comfortable, around 25 to 26. Don't overcover the baby, and if it's nice warm day, you can undress the baby a little. In the winter months, you must cover the head, because that is where they lose heat from and they become very cold. Now, lastly, some danger signs that you should be aware of. If the baby has fever which is persistent and more than 100.5 or about 38, if the baby is very lethargic or inactive or refuses to feed constantly, or if the baby vomits. Now, most babies spit up. Vomiting means throwing up at a distance, or has breathing difficulty, is having to breathe harder, or is not breathing much, or is turning blue around the lips or the hands constantly, or the body, or is developing yellow discoloration of the eyes or of the body, then it is, I think, very important for you to be able to talk to your doctor. So, a happy occasion. The more you know about the baby, the better it is for you. But you should also know there are a number of things that you do normally. You should also recognize if there are any danger signs.